Last week, Michael Brady received some bad news. He was diagnosed with lung cancer. Once a heavy smoker, he already suffers from the lung condition COPD. But now, with a new battle on his hands, Michael is determined to carry on an active life.
If it had gone on any longer, it possibly wouldn't have been curable. But I think 99% in my own mind, it's curable. I'm not stressed about it. I'm just carrying my life on as normal. I don't go to bed thinking about it. I don't get up thinking about it like a lot of people do, because I've had quite a few friends in the past that have had cancer and died through it.
Michael has lived most of his life in a working class part of North Manchester, a city that has some of the poorest boroughs in England and cancer rates that are significantly higher than average. Many of those cancers are linked to lifestyle, smoking, eating and drinking. On that basis, more than 4 out of 10 cancers could be prevented. Here in Manchester, of all the premature deaths caused by cancer in those under the age of 75, it's lung cancer that is the biggest killer. And the really difficult thing about lung cancer is it's extremely hard to spot until it's too late. The NHS has sometimes struggled to reach those in poorer communities who are at greater risk. So across Manchester, mobile scanners that can detect lung cancer have been deployed to those areas where it presents the biggest threat. Elaine Walker lost her husband to lung cancer and the pain is still raw. So she knows how important these scans can be.
I just wish people would take notice and have this done, because if they've not gone through what I've been through, they're silly if they don't have it done, that's all I can say. It's an opportunity for people to save their lives.
But why is cancer such a big killer in Manchester? Research suggests the answer lies not just in the choices we make, but also the chances that life offers us. A fulfilling job, or what's called meaningful activity, helps to make us less vulnerable to illnesses like cancer.
It means you're more likely to make the healthy choices, more likely to eat healthily, not smoke, be physically active, control your weight, and the like. The other is it relates to the body's stress pathways. The neuroendocrine stress pathways deprive people of control. That's a more stressful situation.
So that sense of control, that relates to health?
I think control, empowerment is absolutely key. When people are disempowered, when they feel they don't control their lives, why should they bother making the healthy choices about non-smoking and healthy eating?
More of us than ever before are surviving cancer thanks to better treatments. But the next big battle is preventing people from developing the disease in the first place. Dominic, Hughes, BBC News.